All right, and good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who addresses your COVID questions and the latest COVID news right here on the Havey Institute for Global Health's Facebook page every Tuesday and Thursday afternoons. And today, Dr. Murphy will be answering your questions and addressing the latest COVID headlines through today, the 14th of April. And should you have a COVID question, feel free to email it to us at globalhealthinstitute@northwestern.edu. We'll be happy to answer it live here on these segments. And leading the discussion today is Sophie Piskowski, who is a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Morning.
So now for some updated COVID statistics. In the United States, we're having a 22% increase of COVID cases in the last 14 days. We are averaging about 33,691 positive cases, but yesterday in Illinois, we saw nearly 53,911 new cases. Hospitalization and death rate are both decreasing in the United States, which is great, but in Illinois, hospitalizations have increased by 4%, along with cases are now increasing by 44% in the last 14 days in Illinois. What can you tell us about this hospitalization increase that we're seeing in Illinois?
Yeah, well, it's happening all around the United States, and it's much worse than these numbers are stating. So we're over 50,000 cases a day. This is up from less than 20,000, I think. And, it's going in the wrong direction, and it's not picking up anybody who got diagnosed with an antigen test done at home. There's no reporting of those people. So I know a lot of people have had the diagnosis made at home. They had relatively mild disease. It never got reported anywhere. So it's a grossly underreported number. Now, the good news is that the hospitalization rate and death rate have not changed yet. Now, remember, those are very late metrics. So it takes weeks to end up in the hospital and then weeks to die from the disease if you're going to die from the disease. So that comes later. So we'll see. We'll see if the amount of people who have had Omicron already, plus all the people that are vaccinated or both, if they're protected from severe disease from these numbers. And only time is going to tell.
Yeah, absolutely. And now for a big COVID headline, the mask mandate on planes and trains extends another 15 days, the CDC has announced. What can you tell us about this huge update that we heard from the CDC?
Well, this is really big because this is one of the few places where the federal government does have control. They can mandate things, unmandate things. They can do whatever they want, and the states can't say anything. Now, you can always sue the federal government. I'm sure people will, because they obviously don't have, they have the right to do that, and they want to do it. Okay, go ahead. However, the airports, people are mixing from everywhere around the world in the airports, and then being on an airplane, packed in there for hours with all these people. It's just asking for trouble to loosen any restrictions now with the cases going up. The cases are not flat. They are going up right now. And actually what surprises me here is that they've only extended this mask mandate in this high risk situation for 2 weeks. What is going on? I'm trying to read the tea leaves here, and I just don't get it. I think there must be a lot of pushback to eliminate it. I was in the airport myself yesterday. People don't want to wear the masks. I mean, they were even saying it on the airplane I was on. I was glad everybody was wearing a mask. But I think there's pushback there. I think they're trying to figure out what to do. I think this needs to be extended, and maybe for many months.
Yeah, no, absolutely. And going right into our second big headline, which ties into why this is necessary, is that we have now found 2 new Omicron subvariants are spreading quickly through the state of New York. What can you tell us about these new variants that have evolved from BA2?
Sophie, this is the whole problem. There's so much out there. It's just continuing to mutate, continuing to mutate. continuing to become more transmissible. Hopefully, it's not going to be more severe. It's going to be very interesting to see what those new subvariants do. It would be great if they just mutate out of existence, but that hasn't happened yet. And the last couple of big mutations, from Delta to Omicron to BA2, it's been worse each time in one aspect or another, either worse disease like with Delta or more transmissible like with Omicron and BA2.
Right.
So, and now we've got these subvariants, but this is the nature of the beast. And this is why we don't really need to let our guard down in certain situations.
Right.
And I think like the airport story and trains, public transportation, where people are mixing like that and they're on top of each other. This is just a recipe for disaster.
Right. No, absolutely.
Mm-hmm.
And our last big COVID headline, and Kristen, do you mind pulling up the graph, is that the world has now surpassed 500 million known coronavirus cases amid concerns about the testing. What can you tell us about this crazy number of 500 million people have had COVID?
Well, it's just amazing, and it's, obviously underreported. So who knows what the real number is? That's the lowest number that it is. And you see the waves there. And I mean, I think one thing that's the most dramatic thing about this is that Omicron wave. I mean, look how big that wave is compared to the other big waves, the Delta wave there, and then the earlier one from a year ago in the winter. And that is massive. Now, you didn't see like a big death spike, the death spike is not as dramatic, and that's for a couple reasons. One is that we have the vaccines now, people are mitigating more, the treatments are better, they know how to take care of people in the hospital better, and the Omicron virus was less severe. So all those things, dampen the severe disease part, getting ending up in the hospital. And plus, so many people are vaccinated, a lot of them don't end up in the hospital. Like when I had it, I mean, I was sick, but I didn't end up in the hospital. Good, and most people do not. But it's still a risk.
Yeah, no, absolutely.
Mhm.
And now going into some of our COVID questions. This first question. This individual says, my husband and I have been wondering if we should get the second booster. We're both vaccinated and we've had our first booster. We are both 52 and healthy. We heard the efficacy of the fourth shot is low, so we are wondering if it's worth it. We may be taking a vacation next month to Vegas, so not sure if the extra precaution is necessary. What would you say to this individual?
Well, unfortunately, they should take it. And the vaccines are approved. The second booster, which is your fourth shot, all right, is approved for people 50 and older. And anybody with almost any underlying medical disease. That's about a third of the population right there. So you take people over 50 plus all those people who have any kind of thing, any kind of medical condition, and that is what the recommendation is. You want to go to Vegas, you're going to fly to Vegas, you're going to be in Vegas, you're going to be, gambling and cheering and laughing and stuff in this big casino indoors. And, I think, the downside of taking another booster is so low, and you may get a benefit that you should take it. I don't see the downside there. Now, if the people are otherwise healthy and under 50, they're not even eligible to take it. Those people should wait until version 2.0 of the vaccines are developed and approved.
Wonderful. And that goes right into our second question, which is there any reason why a 31-year-old who has been fully vaccinated by booster, or by Pfizer, including the booster, should not mix and match with Moderna for a second booster?
Yeah. So there's two parts to this question. One is a 31-year-old who is vaccinated and boosted, which is great. Otherwise healthy. They don't need another a booster shot, and they're not actually authorized to even take it unless there's some underlying medical problem. Now, if they do, if this person does have an underlying condition, they have diabetes or something, mixing and matching can be good. And I have recommended to my patients to consider mixing and matching because they are different vaccines. You get a little bit different immunologic response, and together with the other response you had, maybe that's helpful. There is at least one good study that showed the immunologic markers improved in people who mixed and matched. And there's plenty of clinical data, especially from the United Kingdom, that was running out of doses when they were having their crisis, that at least it doesn't hurt and may be beneficial. So the mixing and matching, yeah, but for 31 otherwise healthy, they don't need it yet. This is the kind of person that should wait for version 2.0, like you do with a flu shot. You wait every year, you get the new flu shot. Same thing with this person.
Wonderful. And now for our last big COVID headline. Dr. Murphy talked about Philadelphia instituting the mask mandate because they're seeing an increase in cases. Dr. Leanna Wen, who's on CNN, has a column in the Washington Post that came out that says the exact opposite. She is against Philadelphia taking this approach and has otherwise said that city/state should not do this. Dr. Murphy, could you tell us about what you think about this and what is really going on in the press, et cetera?
Yeah, okay. So first of all, Philadelphia did a very smart thing. They saw the cases upticking, and they know what comes after the uptick in cases. Hospitalizations and death rate goes up. I mean, how many times does this have to happen? All right. So they did the right thing, and totally within their right. The Supreme Court goes back to the state of Massachusetts in the early 19th century, where they allowed the state to mandate smallpox vaccination. So it's been in the Supreme Court several times. That states can do what they want. Your health is not mandated at all by the federal government. Everything is by your state government. The states have a lot of power, and within the state, they can give it to other health authorities in the state. So Pennsylvania can let Philadelphia do what it wants and whatever. Some states, like I won't even mention their names anymore, but some states have actually made rules against cities and counties even trying to protect themselves. Anyway, but it's up to the state. And so the state is allowing Philadelphia to do this. And, you're going to see this in other places. You're going to see it in the Northeast. You may see it here in Chicago because we have very good public health in Chicago and Illinois. California, the states that are a little bit more progressive. You're going to see this happening. As far as Dr. Wen, she is not an infectious diseases expert. All right. She's an emergency room doctor who has public health training. Great. But I think her comments are completely off base here. I don't know where they're coming from. I mean, frankly, I would discard them.
Wonderful. Well, those are all of our COVID questions for today. Thank you, Dr. Murphy.
All right. Well, have a great day and see you on Tuesday. Have a great Easter weekend.